The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to How to Stay Healthy, where we interview doctors each week across the vast medical landscape of cardiology, neurology, orthopedics, sports medicine, and primary care. Join us here for your prescription to better health.
Art of Del Rey Art Gallery, the Heart of Del Rey Art Gallery. And as you can see, a lot of the art right here, and they have an open house tonight, so if anybody's in the Del Rey area, come by the Heart of Del Rey Art Gallery. Tonight we're going to have a very special guest. We have Ed Salazar. Ed's been a respiratory therapist in the Tri-County area of South Florida for the past 43 years. Tonight we have a very, again, interesting show. The show is going to be particularly geared toward respiratory disorders, mainly COPD and other respiratory disorders. Ed, right now there's a major problem with people suffering from COPD. While they're staying at home, they have very, very little potential of any kind of quality of life if they don't get the proper care. Is that correct?
That's correct.
What are some of the symptoms of COPD?
Well, primarily, people with high acuity, acute COPD, the biggest problem is they can't clear their secretions, and they start to exacerbate. An exacerbation is a condition where they get to the point that they start having elevated CO2 levels, their respiratory rate increases, and they start falling into what's called respiratory failure. And if this gets to the point where it becomes life-threatening, and it frequently does, then it always results in a trip to the emergency room. Frequently, it results in a hospitalization as well.
Now, COPD is constantly may cause readmissions to hospitals. Is that correct?
Yes.
And today, we were at All County Healthcare. And one of the things that the hospitalists are telling us now, that they want to cut the readmissions to the hospitals. It's costing Medicare and it's costing insurance companies fortunes of money for these readmissions, where people suffering from COPD and respiratory have a tendency to be readmitted within the first 13 days. Is that correct, Ed?
Well, actually, it's a 15-day readmission rate.
15-day readmission.
In the state of Florida, right now, there are approximately 70,000 admissions for exacerbation of COPD in acute care hospitals all over Florida. Now, the average length of stay for that hospitalization is about 4.5 days.
And what's the cost of it?
Well, the cost ranges from about $30,000 to as much as $64,000, depending on the hospital and depending on the patient's condition. The thing that has got CMS so disturbed is the fact that of that 70,000, 15% of them are back in the hospital 9% are back in the hospital within 15 days of discharge. In a 30-day, 1 in 5 will come back, 20% will come back. And there's a huge initiative now by CMS to motivate hospitals and to motivate nursing homes, all of these people that are charged with the responsibility of caring for these people. There's this initiative to find something that they can do to break this cycle. And we call it the cycle.
Tell the people what CMS is. CMS is Medicare, isn't it? It's
Yes.
basically the
Center for Medicare and Medicaid Services.
Medicaid. So, and they paying the bills.
They're paying bills.
They're paying all the bills. And right now, because they're paying so much money, and the hospitals are getting penalized because these readmissions are coming within a 15-day period, the hospitals have asked, what can we do? So, Ed, what are some of the treatments that you can be given when a person, I know a friend of mine, she had pneumonia, her lungs filled up, she went home, within 3 days she was back in the hospital. They cleared her lungs, went home again, 3 days again she was back in the hospital. If she was getting proper home care, is there anything now in home care that can help relieve the COPD sufferer?
Okay, well, let's back up just a little bit
Okay.
to what they do in the hospital.
Okay, what do they do in the hospital?
Okay, in the hospital, they've got access to a lot of different drugs. They use a medication that's called a bronchodilator to dilate and relax the airways. They have medications that are called mucolytics to thin out the secretions to make them easier to mobilize. They have steroids that they use. Now, but what they also have in the hospital that normally you can't get in home care is physical medicine. They call it chest physiotherapy. They position the patient, they clap them on the back, they do all these things to help gravity drain these secretions for patients that have an ineffective cough. That is the component that is lacking in home care, the physical medicine. Over the last 20 years, dozens of drugs have been developed to treat COPD. And with all of that research and all that development of new medications, outcomes have not improved at all. We go back to the readmission rates in 2013, and currently in 2017, the latest statistics we have, there has been no change. There's been no improvement in outcomes. So it's not the medications. It's this cycle at home.
It's the continuation of care.
Yeah.
So they get a certain amount of care in the hospital, but then when they go home, they don't get that care.
They don't get the same level of care.
Same level of care. But, one of the few companies, which is our company called All County Healthcare, has invested in an interpulmonary ventilation system. Is that correct?
IPV, intrapulmonary percussive
IPV.
ventilation.
Explain what IPV does and how it does benefit to the patient who is suffering from COPD.
Okay, about 30 years ago or so, a technology was developed. They called it high-frequency ventilation, jet ventilation. And it was used primarily in real high-acuity situations, trauma centers, burn units. In fact, in the major burn centers around the country, this is a standard. This is their gold standard of care. The company that developed IPV decided that they would make a platform that could be used anywhere. In the hospitals, they have the 50 psi oxygen outlet. Everybody's seen, where their flow meters, where oxygen plugs in and stuff like that. Okay, well, that's what they use to power the devices that are used in the hospital to do what IPV does. At home, obviously, they're not going to have access to that. So what All County Healthcare has is a platform that has a self-contained 50 psi compressor, so that the same percussive medication can be delivered to the patient in their own home. Okay, and that is what is so unique. And that's what I got so excited about when I started working with All County on this project. Now, what IPV does, that percussive thing that we were talking about, that they do,
Right.
Well, instead of doing it externally, IPV does it internally, which intuitively that'll tell you that should be a lot more effective. And doing it internally and giving them their medicated aerosol at the same time is the advantage of mobilizing secretions in people with weak ineffective coughs and recruiting lost lung volume. In the case of your friend with a pneumonia, the big issue there is that the airways get completely blocked, so the alveoli, or the little air sacs downstream from that plug, they collapse. Okay, if they collapse, then they can't take part in ventilation. Okay, so it makes it that much more difficult for gas exchange to occur. In other words, for the patient to get the oxygen into their bloodstream and get the carbon dioxide out.
So what you're really saying is they really have a difficult time breathing.
Yeah.
With all
Yeah.
that technology, Ed's saying you're really having a difficult time breathing. If you're having a difficult time breathing, and it gets very, very frightening to individuals. I got a call from a friend of mine. He said, Lou, he said, I can't breathe, right? So he rushed himself to the hospital. And the fear of these people that when they can't breathe, it feels like they're going to die. So they're looking for some kind of relief. Now, when you came up with this whole concept, now All County has set up a whole, what we call respiratory team. Is that correct? That you head up?
We call it our pulmonary hygiene team.
Pulmonary hygiene team. Now you head that up.
Yes, I do.
Now we have All County now has purchased a couple of these units from Heaven.
I think you've got 5 or 6.
We started with one, and I think we have 5 now.
Yeah.
5 units being, and every single day these units are out in the field. Tell us, Ed, with the units that we have, how has it affected the quality of life for some of the people that have been on these units and getting this treatment at home?
We have had some testimonials from patients who have had a dramatic improvement in their quality of life. We've had patients that were so weak, their exercise tolerance was so poor, they couldn't go get their own mail, in their condos. Just by improving their ventilation, we've improved their exercise tolerance to the point where they can do many, many more things. People that you would see with their portable oxygen to go down to the pool.
Right.
Many of them have gotten to the point where they don't need that anymore. And
They leave that at home.
They can take part in more social activities. We had a patient who was recommended for pulmonary rehab. Now, pulmonary rehab is an intensive course of physical medicine, pharmacological medicine, and they use the combination of these things to develop an exercise prescription for a patient. So they find out how much exercise they can tolerate, and then they have a systematic method of gradually increasing their exercise tolerance. The sad thing about COPD is that you can't cure it and you can't reverse it. But the objective of pulmonary rehab is to make what is left more effective. Okay, now we had a referral from a physician who was the first time he ever called us. And the reason he called us was that he had a patient that he referred for pulmonary rehab. But the patient's exercise tolerance was so poor that he couldn't even participate in entry-level rehab programs. So, somebody told him about us. He referred the patient to us, and we worked with him through this protocol that we've developed. And typically the protocol calls for one of our IPV treatments every day for a week. And I've trained about a dozen registered nurses from All County Healthcare that will bring the equipment into the patient's home. The patient gets a treatment once a day for about a week or so. Then they'll see them every other day. After that, they'll see them PRN or as needed, and the patient goes back to their physician to get reevaluated, and the physician will he'll determine the efficacy of the therapy and decide whether they should go through another protocol or not, or whether we can just continue to see them PRN.
I think we're going to break for a commercial break. We're time for a commercial break. Ed, we're going to be right back because we're going to talk about some other things. And right now we're going to take a 1-minute commercial. And again, thank you for listening, and we'll be right back.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
And now back to How to Stay Healthy, your weekly doctor's interview and prescription to better health.
We left off, we were talking about COPD and the causes and quality of life. As a matter of fact, All County Healthcare now is partnering with a number of hospitals to try to cut their readmissions down. They're calling us because we're the only company, am I correct, Ed?
Yes, you
that
are.
is serving the public, serving the general populace. For those individuals who are suffering from respiratory disorders, again, I'm going to repeat it, we're the only home health care company in the whole area, that's the all South Florida area, that can basically treat you at home to help you get a better quality of life if you're suffering from respiratory disorders, COPD, could be asthma, if you qualify. So if you have a problem, you know someone is suffering from COPD, listen, give us a call at All County Healthcare at 954-717-7027. We will then instruct you how to get home care if you qualify. It has to be qualified. And if you qualify from home care, then we will be, Ed and his team will make sure that you're well taken care of. Ed, what has been the readmission? Since All County Healthcare started out with one of these units, now we have 5, right? And they're all being used daily. Now we've treated hundreds of patients. What is the readmissions to the hospital that, without this, what is the readmission rate? And after they get their treatment, what is the readmission rate again? If I said that right.
Well, according to akka, which is the watchdog agency in the state of Florida that
Explain what
oversees.
akka is.
It's a watchdog organization that oversees all of the healthcare industry in the
Right.
state of Florida. Now, according to the statistics that they have that are reported by the hospitals themselves, okay, that's where we got the figure of the 15-day readmission rate of 9% and the 30-day readmission rate of 20%. This is what we're trying to break. Now, All County Healthcare and the patients that they have treated, for the 4 years you've been using it now, the readmission rate for All County Healthcare is less than 5% for 12 months, and that's amazing. I
Say that again, 5% for less than 12, that's unheard of.
Well, when I tell people about that, they're shocked, and they say, "Well, can you prove it?" So I show them the statistics. What we're real excited about right now is that we've got some hospitals. I probably shouldn't mention the names.
That's all right.
but
We have a number of hospitals through the South Florida area called us.
Right.
And one of the major hospitals, we have great hospitals right now in South Florida. Whatever people believe from up north, well, I've got to go back to Boston, I've got to go back to New York, I've got to go back here for treatment. Now, we have some great hospitals, great doctors. And one of the leading hospitals in the country is Cleveland Clinic.
Right.
And Cleveland now you made the presentation at Cleveland Clinic. They got so excited, they adopted our program into their pulmonary rehab.
Well, they have an in-house pulmonary rehab program
Right.
at Cleveland Clinic, and they were very impressed with the IPV. So we had a unit in their rehab, for a while. We're also working with some other hospitals to develop what is called a transitional care program, so that if the patient is getting the IPV therapy in the hospital and it proves effective in reducing the length of stay and bringing them back to optimal condition sooner, then we can continue the same therapy at home. See, this has been unheard of. This has not been available before All County developed their IPV program.
We chatted, and Barbara Bush, President Bush's wife, who just passed away this past year, I think she was suffering from COPD. One of the main problems, she was suffering from COPD. And she was tired of going back and forth into the hospital. She decided she didn't want any more treatments. But if she had the IPV unit next to her bed, right, she'd probably still be living today because she'd be taking her treatments. We had a gentleman on well over a year, wasn't he on well over a year?
We've had one fellow who was on it for over 3 years.
3 years.
Yeah.
And he fought us because he wouldn't let us take it away.
That's right.
And that was basically his life-saving device, he said. Without this unit, he would have been dead.
Well, the only time he ever got in trouble was when he went out of town.
But he went out of town.
We had a testimonial that that reminded me when the commercial spot was playing. We got a testimonial letter from the daughter of one of our patients, and her father was a snowbird. Came back and forth from North Carolina, and she couldn't believe how well he did on the IPV down here. And so the first thing they did when they went back to North Carolina is ask for it, and it was not available. She was quite distraught about that. She actually sent a letter to me wanting to know how she could get access to the same therapy for her father now that he was back in North Carolina.
We at All County, we're a home health care agency. We're Medicare certified. And as a home health care agency, we take care of, as you heard in our commercial, wound care, diabetes, med management, physical therapy, occupational therapy, behavioral therapy. But we're the only, all the companies can do that. But we're the only company, and I repeat that, the only company that can treat COPD in-home properly. There are other treatments. There are treatments that they call vest therapy. Am I correct, Ed? Vest therapy. Now that's putting on this bulky vest.
It's chest wall percussion. External chest wall percussion.
And the patients really don't react well to that.
It's usually poorly tolerated by adults. It was developed primarily for use with cystic fibrosis children, but we call it compliance. The patient's willingness to use the therapy.
Explain what IPV is. IPV is when we go into the home. It's a percussive instrument that the person takes. We give them their own mouthpiece. They breathe into it for 20, 30 minutes. Is that what it is?
Every patient has their own circuit, and the nurse brings the unit, the percussive unit, into the home so they can use it.
It's portable, so it comes into the home.
Correct. The treatment usually, in order for it to be a good effective treatment, it has to last about 20 minutes. And now this is another issue. Most home health agencies, their business model is based on spending a certain amount of time in each patient's home. When a nurse from All County goes into a patient's home to deliver an IPV treatment, they're going to be there for a good hour. And that's kind of unheard of in home health these days.
So what you're really saying, we don't care how much time it takes to give the person quality care?
Well, you gave us the green light to do it the way it was supposed to be done, and that's what we're doing.
So we will, whatever the patient needs at All County Healthcare, they are told to make sure they get it. Whether it's 1 visit, 100 visits, 50 visits, right? A lot of companies right now, they basically, and I'm not knocking any company, they basically say, okay, a lot of these companies are being bought up by major players. In healthcare, I always think, and I'm a senior myself, healthcare for the seniors today is a personalized thing. And healthcare right now is fading desperately. Healthcare is becoming money. Let's take the money out of the equation, and let's go back to giving these seniors what they need so they can have a better quality of life. At All County, we strive on one thing, quality of care. Am I correct?
Well, the evidence of that is that several of the referrals we've gotten have actually come from CMS. Your agency has a certain rating, and they have a history. And that history is such that when people do come from out of state, if they call CMS for a recommendation on an agency, if they're in South Florida, we've gotten several referrals that way.
Right. Now, what Ed is referring to, Medicare gives you a rating anywhere from 1 star to 5 stars. All County has a 4.5 star rating, and we're getting up to 5s very shortly, but we have a 4.5 star rating and a 5 star rating with referrals, people who will refer us back, and patient quality, right? And the other thing we're talking about is, if you want any information, go to our website, www.allcountyhealthcare.com. That's www.allcountyhealthcare.com. That'll explain to you what services we provide, how we provide them, right? And remember, healthcare, home health is covered by Part A. Doesn't cost you 1 single cent. All right? And the difference is under Medicare, you get as many visits as you need to treat your ailment. That's as many visits you need to treat your ailment. Ed said that the first treatment for COPD is 7 visits for the first week, 4 for the second week. But if you need it for 4 the next week, 4 the next week, 4 the next week, you get it. As Ed said, one gentleman's been on for 3 years. Am I correct?
Yep.
So we don't stop it. We don't say you're going to stop at this visit or that visit. We're going to make sure that you get what you need. And again, respiratory disorders today is becoming a major, major problem. Talked to a friend of mine yesterday. I said, why are you home? He said, well, I got major sinus problems. Who's getting pneumonia? Who's got a flu? Who can't breathe? It all stems from the respiratory disorders. Now, you or your family member, if you're listening, you might be suffering from COPD. Your family member, one of your family members might be, or a friend. Mention that you heard about this new IPV treatment that can be done in-home by All County Healthcare. And Ed's team will make sure that you get the treatment that you necessarily need. Ed, what's going to be happening in the future for this is COPD? Is it increasing? Is it becoming an epidemic? What's going on?
Well, you know, there have been drastic declines in heart disease, in vascular diseases. So much research is being poured into diabetic, treatments and such. But COPD has remained flat. It's actually even increased a little bit, even though with the decline in cigarette smoking. So it could be a number of different factors. Environmental, the food we eat, But right now, 80% of all hospitalizations in the United States are for chronic conditions, and COPD is one of the leaders.
Can the IPV, can it treat mesothelioma? Is it mesothelioma?
Well, if you have someone with mesothelioma and they develop perhaps a pneumonia as a consequence of that, then it could be useful.
Okay. Well, they're cutting me off right now. They're telling me we have to say goodbye.
He's getting the hook.
And we want to thank you all for listening again. Thank you again for listening. And remember, All County Healthcare. Thanks again.
For a prescription to better health from the top doctors in the medical fields of cardiology, neurology, orthopedics, sports medicine, and primary care, join us each week on the How to Stay Healthy show.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.